to introduce Eric Dyson of Wellspring Financial Partners, who will introduce our speaker for the day. Eric?
Hello, everybody. Thanks, Rich. Real quick word about Wellspring. I know many of the attendees are clients and you're familiar with us. And if you're kind of looking at the screen and you see RHSB, yes, you're at the right place. I'll introduce Sebastian, our other speaker today. But at Wellspring, we believe every individual, no matter where they are in life, deserves access to education, support, and mentoring about the financial marketplace. And we think everyone should have a financial plan and access to the best tools, best investments to make that work for them. We serve as an ERISA 338 investment advisor, and we go to great lengths to make sure your employees are educated and equipped to make smarter day-to-day financial decisions. That includes household finances, debt management, budget, college savings, Social Security, preparing for retirement. And today we're going to talk about some healthcare choices, which allows me to introduce my guest speaker, Sebastian Sanchez. Sebastian is with RHSB. He's a vice president there. Got some unique experience on how he can address the small to the mid-sized market. I asked him to put this picture up of his family. So he's about to talk to us about financial wellness. You can tell that he's young, good looking, and in good shape. So that also makes him qualified to talk about health wellness at your company. So Sebastian's going to start out talking here about what the financial impact is, how you can potentially measure some of those factors, and what you can do as an employer to kind of look at those numbers. And then for the second half, I'll be talking about financial wellness, same issues. What are some of the numbers we can look at and what you can do as an organization to make an impact to those numbers, and what you should do for a financial wellness program. We've both got very full agendas with our slides. We'll be going quickly. Rich mentioned questions. If you want to slow us down and answer a question on the fly, please type it in your chat window, and Rich will flag us down and slow us. With that, I'd like to let Sebastian take it from here and talk about health wellness at your organization, the employer. Sebastian, it's all yours.
Thank you, Eric. That was a very kind intro. I appreciate that. As Eric mentioned, I'm a Vice President of Employee Benefits at RHSB. And so today I want to talk about clinical wellness as a financial tool. And for those of you that enjoy having an agenda and being able to follow, these are the three main topics that we're going to discuss today. We're going to identify if there is a need for corporate wellness, explain the difference between wellness ROI, return on investment, and wellness VOI, the value on the investment. And then finally, we want to provide a roadmap for a successful and measurable wellness solution if you decide to go that route, or if you're already doing it and you just need to recalibrate your approach. So let's start off with if there is a need for clinical wellness. You may have heard of metabolic syndrome or metabolic disease, and I want to highlight that. The definition is on the screen. It's a cluster of conditions that occur together that basically increase your risk for heart disease, stroke, type 2 diabetes, and there's honestly a list. The list goes on pretty serious conditions that affect both the health of the individual, but also finances of that individual and finances of the employer, because these claims will hit the medical plan. I included this image here on the right. This is Dr. Eric Bricker, who is the Chief Medical Officer at A Healthcare Z. He was previously the Chief Medical Officer for Compass Health Solutions. And he's got a great program where he actually provides snippets, short videos every day of the week, and posts them on all social media outlets. I mostly catch him through LinkedIn. And so if you don't follow him, I highly recommend it. But I posted this image on here because he did a 5-minute video on metabolic disease. It was based on a study that came out just a couple of months ago. The main findings of that study was that metabolic syndrome accounts for 75% of the healthcare costs in the U.S. So what is metabolic syndrome? Well, we explain what conditions fall into that. But metabolic syndrome, the good news about it is that it can be easily detected through a blood sample. And it basically measures 5 aspects of an individual's health. And if 3 out of 5 of those are off, then basically that individual would be positive for metabolic syndrome. Now, they may not at the time be experiencing heart disease or diabetes, but they are well on their way, and studies have shown time and time again they are well on their way towards these serious conditions. So the good news is that it can be detected. Another set of good news is that it can be prevented. So if somebody is tested for it and they've found to be positive for metabolic syndrome, there are ways through healthy habits and diet and exercise and really changing an entire set of lifestyle that can prevent or move back the needle on metabolic syndrome. Now, here's where it gets to the employer side. If 75% of all Americans are basically positive for metabolic syndrome, that percentage would look probably pretty similar to your employee populations. So it's very likely that you have a lot of ticking bombs walking around your office hallways. So is there a need for clinical wellness? Well, the answer is yes. That is something that you want to address if you care about your individuals and if you care about the financial aspect that represents for you. Now, as far as wellness solutions, there's a myriad of wellness solutions out there that you can choose from. I'm not trying to make a plug for any of these, which is why I listed several of them. They're all very good at what they do in specific ways, and they're all cutting edge in one way or another. So you can look through and you can shop through the market to find a wellness solution. One thing you can find is you can find a cost, how much they're going to charge you for their services, whether it be a per employee per month cost or a fee. You can find the cost on your investment towards finding a wellness solution that's going to create some savings. So that brings us to our first point of an ROI. This here is the equation of ROI, return on investment, which is basically the return or the benefit divided by the initial investment or the cost is what gives you your return on investment. So if we solve for X when it comes to wellness, we can agree that the cost is going to be the cost of the wellness program, and the benefit would be the savings as a result of the workplace wellness program. Now, the problem that we run into and that you should be aware of as an employer is that it is actually very difficult to measure return on investment on a wellness initiative. The reason for that, and I'm not going to go through all of the ones listed on here, but take just a couple for example. If you have over 20% turnover within your organization, your sample of employees is changing so much that it's nearly impossible to measure if your wellness strategy is actually having any effect because you're constantly starting over with new employees. On top of that, you have things like genetics, which you can't control through wellness. You have true buy-in from employees. You're going to have some that are just going to drag their feet to just check the box in case you have it set up to where there's a penalty for not completing certain things, and there's not going to be any lifestyle changes. It's just going to be doing the bare minimum. So all of these things put together can really affect measuring the return on investment. I'm going to talk about two studies very quickly. This first study was a 4-year study with a focus group that was on an employer plan and going through a wellness initiative. The study claimed that they found a return on investment after 4 years, but after digging closer into the wording of the study, it was easy to find that they were talking more about correlation than a true return on investment, where it's like estimated savings, projected savings. They're basically what they're saying is because we didn't have, for example, a heart disease this year, we're going to attach that to the fact that it was because of the wellness initiative. And so you're taking savings that never really took place, and you're assuming that is because of the wellness initiative. So there's a bit of a stretch. There's definitely a correlation, but once again, very difficult to measure a return on investment based on the equation that we saw earlier. This is the second study that I mentioned. And this study set out to do the exact same thing. Now, this one's only in year 2, but this one found the exact opposite. So Forbes magazine highlighted this study which the University of Illinois ran, and it claimed to find zero benefits from corporate wellness. So it's interesting that two studies out there that set out to do the same thing found complete opposite results. Now, it was very interesting to me that in this study that claimed to find zero benefits, they did found a lot of value. And I'll read this quote. It says, however, it was noted that researchers found two exceptions to the claim of finding zero benefits. Employees who joined the wellness programs did become likelier to be screened for health issues, which we talked about earlier. Screening is the first step to really knowing if somebody's at risk. But they also expressed that they thought their employer put a high priority on employee health and well-being. So it created a higher cultural value for those employees, knowing that their employer cared enough to provide a wellness initiative. So that brings us to the value on investment. Even though it may be challenging to prove a true return on a wellness initiative, it is very possible, and I'd say very probable, that you're going to see the value on investment through a wellness initiative. Once again, I'm not going to go through all the ones listed on here, but as you can see, several on there are key aspects of an employer group. Reduce employee health risk. You can be sure that the healthier your employees are, the happier they're going to be, the less medical costs you're going to have. But there's also improved productivity that's been found, improved employee morale, even on-the-job safety, positive impact on business. All of these things have been measured as a value that derives from a true wellness initiative that's put in place. So when you're approaching your wellness plans and your wellness initiatives, it is important to look at it as two different aspects being put together. So the larger blue circle that you see on here is the value that it brings. Some of the things that are intangible that you can't put a hard number on, but that you know that are definitely affecting your population positively. However, you can find hard numbers and find a return on investment through healthcare costs and insurance claims. Okay. So the question is, can clinical wellness be used as a financial tool with measurable results? Well, we just answered that. The answer is yes. And here's how you go about doing that. So the measurable aspects that you have within any employer health group plan is going to really be pivoting around the unit cost. What is the unit cost? The unit cost is the cost per employee per event. Claim payment structure, cost transparency, facility network. Think of it this way. Every time that your employees go to the hospital, go to an emergency room, to the urgent care to have a scan, an MRI, each one of those is an event. The unit cost is the cost of each one of those events. The way that you can measure and control that cost is through two things: control provisions and promoting consumerism. And we'll talk about these. So as we talk about control provisions, why would you even need to do that? I wanted to include this slide, which shows a map of the U.S. and several percentages on there. These percentages are the percentage markup that employer plans are paying for facility use. Okay, now how do we know this? Each facility, and by facility I mean hospitals, clinics, MRI centers, and so on and so forth, they have to report their cost, the cost that it costs them to run any procedure, any scan. They have to report that to the government. That's what the government uses to come up with Medicare. And so we know that's public data. It's available. You can look it up. You can know how much it costs a facility to do a knee scope. Now, once an employer plan is put in place and you have your PPO networks, what we realize is that most states, and you can see here, California, Arizona, Texas, Florida, we are paying, in Texas, for example, 398% markup on top of what it costs that facility to run that knee scope. So the employer, your employer plan is paying almost 400%, or if you're in Arizona, 430% on top of what it actually cost for that facility to run that. It's no wonder why we continue to see renewal increases and we continue to see healthcare costs go up. Now, how do you control those provisions? Well, there's really a spectrum of different options that an employer can choose from. You can go as aggressive as you want to go, or you can take baby steps towards beginning to carve out some of that fat that we're paying all of the facilities. So on the left-hand side is a list of several things that one can do as an employer to address those. Direct primary care, having a narrower network, gatekeeper referral works in some areas, step therapy is huge, drug exclusions, facility negotiating is big, repricing the claim is something that you can do. Now, a lot of these are put into effect more with a self-insured method as opposed to a fully insured, if that's the way that you're addressing your medical plan and through a full insured. There are some things that you can do, but you're limited a lot more than if you're in a self-insured platform. This example always blows my mind, and so I wanted to add it here. A partner of us shared this example with me, and it was regarding the birth of a child for his family. Obviously, he's in the industry, and he has access to self-funded claims, so very itemized details on the bills. But after the birth of his child, he looked through the itemized bill and realized that for every diaper that was used while they were in the hospital, the diapers were being charged at $35 per diaper. Now, the PPO plan or the PPO discount network was providing a 50% discount on that. So you would think, well, 50%, that sounds pretty good. Well, that's still making it close to $18 per diaper. He went to the convenience store on the bottom floor of that hospital, which it's a convenience store. It has a substantial markup because it's there for convenience, and realized that he could find a pack of 100 diapers for $30. So you begin to see, once again, that huge percentage markup that is taking place in our current healthcare system, and how employers and employer plans and the employees are the ones that are carrying the weight of having to pay the cost for these. So obviously something needs to change, and it needs to be done through control provisions. What you got to remember is that when you roll out a wellness initiative, you are basically providing an option for people to get screened and become more aware of their health. Once people become more aware of their health, they're going to utilize the plan more. So they're going to need to go to the doctor. They're going to need to have maintenance medications. They're going to need to have more intervention from their plan, which means they're going to be going out there and they're going to be using it. If you don't have control provisions, then that wellness initiative all of a sudden, instead of being a financial incentive, is going to be extremely expensive because your employees are going out and using the plan while there's no control on the provisions. They're paying 400% markup on everything. Now, the other aspect of it is promoting consumerism, which is extremely important. This is specific to the Dallas market, but it really extends through most major cities in the United States. In the Dallas market, and I remove the names of the facilities because it really doesn't matter. There may be facilities that are very affordable at one procedure, but extremely expensive at the next. Pretty common procedures here: an MRI on a knee, a colonoscopy, and a knee scope. You can see, for example, on the knee scope that a facility A was going to charge just over $1,500, and facility B, which in this case happened to be just a few miles away, was close to $6,000. Now, unless an employee knows ahead of time that this is the difference, you can't blame them. They're going to go wherever they're being told they're going to go, and that is what can create such a disparity of change in price depending on where people go. So providing a method for transparency, which there are several out there available, is key. It goes hand in hand with having your wellness initiative. In fact, it should be put in place before you roll out a wellness initiative. So some of the things that we're doing to make sure that people have everything they need is utilizing the technology that's available now to us. It's no surprise that artificial intelligence is taking leaps and bounds. Everybody has a mobile device near them in their phone, in their pocket that they can use. There are multiple applications out there that we partner with that basically make it a one-stop shop where you can use on your phone. You can find everything from your medical ID cards to be able to search for a provider, find the price transparency from facility A to facility B, be able to set an appointment through that, see your claim, all that information available through one easy to use application device. And so that's key. If you don't have something like this in place, it's nearly impossible for somebody to go out and try and figure this out on their own. What they're going to do is they're going to come back to you, and your HR team is going to have to carry the weight of trying to figure all of these things out for your employees. Now, another part that's key is implementing a strategic communication strategy. So, if you have a wellness strategy, it's really moot without the proper communication behind it. Every company that I work with is different. Some are blue collar and require papers and flyers and live meetings. Others are white collar, technical, and require emails and webinars and videos. The strategies look different for every employer, but you have to have a strategy in place that continues to drip communication throughout the year, and obviously has a strong push during the open enrollment periods of time. So those two aspects are key when it comes to finding your controlling your unit cost. So we come back to our ROI equation. As we tried to solve for X, we talked about the value that's really difficult to measure. You can't measure for something that never took place, but you know that you probably affected it. So there are some savings involved there. And I highly encourage people to realize the value on wellness, but it can be measured. What can be measured is the unit cost and how you control that. So you know the initial cost of your workplace wellness and any other vendor partners that you use for price transparency, repricing, anything else that you may be using as part of your strategy. And when you have those in place, you can actually find dollar amounts that show you the savings as a result of your workplace wellness. So you can see clearly if somebody went to facility A after they were going to go to facility B because they contacted their price transparency and were redirected. You can see $4,000 worth of savings that would have hit your plan but didn't because of that tool being in place. You can also see when you receive a bill that has a $35 diaper that you can reprice that and your ultimate cost out of pocket be a lot less, and that you can measure that, you can see the dollars and you can find the savings. So multiple ways to look at how wellness can be implemented, and also how you can find financial savings, ultimately affecting your bottom line. So that is the end of my portion. If there are any questions, I'm more than happy to answer those at this time. If not, I do want to give my time to Eric so that he can continue on with the presentation.
Rich, I think that we're doing okay on time. If anybody on the broadcast has a question for Sebastian, if you want to add that, or Rich, if any have come in so far, let's go ahead and take care of questions that might have come up so far for Sebastian.
Yep, Eric, we had one question, and that is if there's a good way to understand if the employees are actually paying high markup, what's the best way to chase that down?
Yeah, absolutely. That is a common question. As I mentioned, unfortunately, our healthcare system is not set out to be easy to understand. And so I work with a lot of HR and CFOs that come to me with this very question. And the answer is you really can't. You don't have access to it unless you have a strategy in place that's going to provide you some price transparency. So the markup is there and is present, as you saw on that map of the U.S. We can measure and we can know about the average. We're about 400 to 450% on some of the southern states here that we're paying on top of the cost of these facilities. But from there, you really won't know what effect you're having within your own population unless you have that price transparency tool put in place. So if you don't have that, I would definitely recommend looking into that, because that will basically open the door to see behind the scenes and really see where your savings are, and how to get a hold of those.
Okay, thanks. Let's continue to yours, Eric.
Okay, Rich, thanks. So for everybody, you're going to see a lot of similarities. And remember, we're talking about both health, wellness, and financial wellness. You know, kind of a common thing is if we can get the employees, your population, just people who care and be more aware and be more engaging, that's really where we're going to go. So I'm going to spend some time defining the scope of the problem. And we see the problem actually getting worse from some data points. We're going to give you a definition of financial well-being. So when we talk about financial wellness, if you ask 10 different people, you probably get 10 different definitions. And we're going to tell you where we came up with this definition and what we think you ought to focus on. We'll talk about costs of the company bottom line. There's a slight difference of what employees think they want and what they really need, as you might imagine. And we'll focus really on what does a good financial wellness program look like. You see this next to last bullet point of reference documents. I'm going to go through a lot of references here, a lot of statistics, and I'll go through them very quickly. And just like in Sebastian's presentation, if you need to slow me down or you have a question, type it into Rich and he'll interrupt me with a question. But a lot of the data that I'm going to show and go through quickly, not only do you have the presentation to download, but where we got this information is included in a list of documents here at the end if you want to reference those. So here are some questions I want you all to consider. First one, do your employees make smart day-to-day financial decisions? The most common answer to this question I get from people is they look at me quizzically, and this is when I say people, this is human resource professionals and CFO and finance professionals. They look to me when they answer this question with a funny look in their face and say, gee, I don't really know. That's the most common answer I get. The second most common answer I get is, yeah, I don't think they're making smart financial decisions. They know that from either people asking for advances on paychecks, amount of 401k loans. I've only had one person, so I have to admit that there was one person saying, yeah, I think our employees do make smart financial decisions. One time I gave this to a group and I heard a loud voice from the back yell, no, they're not. And that's what I think the majority, but just take it for a notion that most people answer this, gee, I don't know. And I'd ask you to ask that question yourself. What percent of your employees are financially stressed? To shorten this presentation to fit in the time, I don't quite have as much data on this question, but I'll answer this question for you right now. Depending on which study you look at, they're all around 50%. And most people that I ask this question, they come up with a number that's at 50% or more. It doesn't matter whether they're making $300,000 a year or $30,000 a year. That percentage is a little less for the higher income earners, but what happens is they just take on more debt, and their debt numbers and their bills have an extra zero compared to the 30,000 per year employees. Yes, there is a little difference, but across all demographics, it's roughly 50% of your employees are financially stressed. What percentage of employees who retire in the next 5 years are confident they can manage their retirement assets? And same thing, in the interest of time, I'm just going to answer this. Most baby boomers will say, and when I say most, this is about 2/3, will say they're confident they can manage their assets to last their lifetime. But when you ask them a number, how much that will take, it's less than 20% can actually answer that number. We're really going to focus on the last three questions here. What value of lost productivity in your workplace is a percentage of total payroll? In other words, financial stress is causing your employees to be less productive. How much is that costing your company? And not only financial stress from productivity, but we'll add things like turnover and increased healthcare issues that are caused by stress. So that's the difference between number 4 and 5. 4 is just loss of productivity. 5, we're going to add in turnover. We're going to add in healthcare costs. And number 6, what I think many of you would be interested, if you only got one thing really out of this, what if we have employees that are on track for their financial goals? How much happy are they? How much more productive are they? How much more loyal to the company are they? It's a pretty dramatic increase. I'm going to show you those numbers as to how much better off they are at work if you can get them, if we collectively can get them on track financially. So we're going to start by defining the scope of the problem. So if you add up the numbers here, hopefully you can see my mouse scrolling around the little voices or the thoughts. They do add up to 100%. So out of 100% of people that are stressed, 46% of that stress comes from money matters. Not marriage, not relationships, not the job, not health concern, but almost half of everybody who has a stress issue is due to money. And as a refresher, all these references are at the bottom, and we'll show you those at the end of the presentation. And here we're showing the problem getting worse. So this question, hey, I'm having difficulty meeting household expenses. In 2017 and 2018, we were around 40%, 42, 37%. That has gone up in 2019. And you see these broken out by millennials, Gen X, and baby boomers, okay? The next couple slides are just to show you that the problem from 2018 to 2019 has gotten worse. This one is, can I meet my basic expenses if I'm out of work for a prolonged period of time? 2017, 2018, we had 45 and 47% said, yes, I could meet my expenses if I'm out of work for a while. In 2019, that's down to 31%. And you can see where the different generations fall in there. So here's another good statistic for you that goes along with the last slide we came up with. As a general rule, I think most of you would agree 3 months is probably a good benchmark for how much cash you should have in emergency savings. So you have a medical emergency, you're out of work for a while, you can pay your bills, pay the mortgage, pay the rent, keep the electricity on. Almost half of all Americans have less than 1 month of emergency savings, and 30% have between 1 month and three months of savings. So that means 86% of Americans have less than 3 months of emergency savings. And that leaves us with, yeah, there's a little bit of a rounding error here, but 13% have 3 to 6 months or greater than 6 months of emergency savings. I can also tell you that from a lot of studies of the number one thing that someone could change to reduce their stress level, this one factor right here will reduce people's stress the most if we can talk to them about their emergency savings level and get that to where it needs to be. For those of you that are Wellspring clients and you've gone through the exercise with the retirement spending report, one of the things on one of the pages, first question we ask your employees is, do you have enough emergency savings? And we encourage them to get that in place before they do just about anything else. So I think this is the last slide on how the problem is getting worse. Stressful dealing with my financial situation. Look at these numbers in 2016 to 2018, 52, 53, and 47%. In 2019, that number is up to 67%. So financial stress is getting worse as we measure it over the last year. So now what we're going to talk to you about is how do we define financial wellness? How do we define financial well-being? Does it mean no debt? Does it mean I have enough savings? Does it mean I'm on track for retirement? And what we found is we did a lot of research on this. When I say we, this is internal to Wellspring, right? There are a lot of firms out there, okay? There's very little regulation like there is on ERISA or Department of Labor or the IRS. People can come about and just say, hey, I'm a financial wellness expert. They can put a platform on a website. It doesn't involve all the extensive requirements of a record-keeping platform, but there is no standard industry definition of financial wellness. So what we found, we went to a study by the Consumer Financial Protection Bureau, and we very much agree with this definition. We're not telling you that you have to adopt this, but you as HR professionals, finance professionals, those who are helping your employees, if you're going to adopt a financial wellness program, we think you ought to define what does financial well-being look like. So this is the verbatim definition from that study. A state of being wherein a person can fully meet current and ongoing financial obligations, can feel secure in their financial future, and able to make choices that allow them to enjoy life. And it also includes this diagram, which I think better describes us a little better. What I describe this is freedom from worry, or excuse me, freedom from stress and freedom of choice in both the short run and the long run. I'm going to repeat that, what this is essentially saying. Freedom from worry and freedom of choice in both the short and the long run. So let's look at this. Here we are in the short run. Do I have freedom from stress? Okay. Can I pay my bills? Am I worried about keeping the electricity on? Am I worried about making the rent payment every single month? And then on the present, freedom of choice, the example I always give is if you find out grandma's about to have her 90th birthday and grandma lives 6 states away and you have to buy a plane ticket and a hotel, which isn't a major expense, but do you have enough finances to enjoy life and make some choices? This doesn't mean a 6-month round the world vacation, but it's enough freedom of choice to live your life so you can enjoy family and friends, okay? So for the future, we're talking really long-term, more about retirement. Can you absorb a financial shock? Can you absorb what might come with a major medical expense? Can you absorb the shock of just finding out a financial disaster? And then the freedom of choice for financial, your future is, am I on track to meet goals? So if you don't have a definition of financial well-being, I urge you to start with this. Look at whatever you have for a program and see if you're matching up to this, okay? The next is how do you go about measuring financial wellness, okay? Sebastian kind of gave you some methods to measure, hey, what is spend? And we talked about in the health area, there's some things you can measure, some things that you cannot. Well, we also found from the same study that this is one way to measure how your employees are doing from a financial wellness standpoint. And the nice thing about this survey is it's got tons of data already behind it. So once again, this is from the Consumer Financial Protection Bureau, and it's a 10-question survey that your company can do. You can actually build this yourself, right? We provide you the reference. You could administer the survey to your employees and figure out, hey, how do we stand up on this thing? And I will recognize when I mention anytime you do a survey, those of you that are in HR and finance, sometimes that's a little bit of a whipping to get all of your employees to complete a survey and get accurate results. And then once you have this survey, what are you going to do with it? But remember, the big picture is if you're going to have a wellness program, not just some tools, not just a website for them to go to, but we think you ought to be able to measure it. And this is one way we found that will measure it. So here are some just outputs of the big picture survey, and it just ranges all the people, the tens of thousands they did in this study, on a score that ranges from 0 to 100, okay? And those of you that had a few math colleges in college, right, you see it's a nice even bell-shaped curve, and that's how they wanted this to look. But the next slide is very telling. What I kind of want to point out to you here is this 25th percentile, look towards the bottom, the 50th percentile, the median, the 75th percentile. The scores are 46, 54, and 63. So just keep in mind this kind of average. So you would look as, hey, are my employees average? Are my employees as a group below average, or are they above average in their wellness? And here's where we come. If your employees as a whole end up in the 25th percentile, then there's a 78% chance that those employees are having difficulties just making ends meet. 57.8% chance that they have some material hardship, a bill that's hanging over them, collectors calling, okay? If you can move your population into the average, look how much these numbers go down. 57.8% down to 21% of a material hardship likelihood, 78% down to 35.6%. And if we get them into the 75th percentile, look how low these numbers go. So we haven't quite talked about how you move these, but the message I want to give you is come up with a way to measure the success of your financial wellness program. Have a way to measure how your employee is doing. So let's say that this is not the tool you choose. You can, as example, set as a goal that we've used this online wellness platform, and we want to set a goal that at least 50% of our employees have gone through this video module, or at least this percentage have developed a budget online, or they've engaged in some kind of a module. So we're giving you an example here of how to measure it. If you have specific questions, most of you are Wellspring clients, you're talking to Deirdre, please engage with Deirdre. You can reach out to me, and we're happy to have this conversation with you. Those of you that are not clients, obviously still happy to have that conversation with you, where to go and how to measure your wellness. So next is, well, how much, if you don't have a wellness program, how much is it costing you? And once again, we have a number of studies that all point to some similar numbers, right? Just like Sebastian had some different studies he showed you, some of these studies are a little different. So here's a very simple number. If you want to take away all the math I'm about to show you in some different studies, but stress costs businesses in the US $300 billion annually, okay? And the studies there at the bottom are the reference from New York Life International Stress Awareness. But you can just say, if you do nothing for financial stress for your employees, take $1,685 per year, multiply by the number of employees, and that's how much it costs you to do nothing. It costs more in terms of higher medical costs, it costs more in terms of turnover, it costs terms of more of absenteeism, and costs more in terms of presenteeism, okay? We can't necessarily make that entire number go away because, as you all know, no matter what good programs you put in place, not every employee is going to follow. But start out with this as one of the numbers. If you want to just say, hey, I've got 100 employees, basically it's costing you $168,000 per year to do nothing regarding financial stress. So what I'm about to move into is another collection of studies that this will take into account. Well, people have different pay scales, there are different reasons for that, but a couple items. So number one, presenteeism is people are actually showing up at work. Look at the graphic in the lower right hand side, right? We have this person at his or her desk at work, but they're just not being productive, okay? If somebody is financially stressed, they're typically spending 3 or more hours per week doing things to manage their finances. Hey, my tires are bald. I got to find a way to get new tires and I'm not sure how to pay for it. And I got to find the right place and I got to run around town, or I got to turn the electricity on, or I got to get a cash advance from one credit card to pay off another credit card. But roughly 7.5% of payroll is going to simply lost productivity. Absenteeism, workers who are stressed miss roughly 3.5 days more per year. It's roughly double the absenteeism and sick days of those who are not stressed. Turnover, okay, this is a tough one to put a number on. I'm sure everyone who is in the HR profession on this call is trying to convince the CFO and the CEO how much really is lost in terms of productivity and how much turnover costs. So it is difficult to put a number on this, but you have to recognize that turnover, when somebody leaves just to get a higher wage in another company, there's a real cost to that. And so now here's the math. This math takes all those slides in the back, and what you can kind of zero in on is your loss of productivity for all those numbers is roughly 1% of your payroll. So forget that $1,380 we mentioned. This is a new calculation. Just take your payroll, and we're not including turnover here. We're not including additional sick days. We're not including healthcare costs, but just lost productivity work costs you 1% of your payroll. And then if we add up the other items, there's 1% for presenteeism, which we just went over. If you add absenteeism, turnover, and increased healthcare costs, we end up with 1.94%, and I just simply round that. I'm going to say that turnover costs you at least 0.06% of payroll, but doing nothing in regards to a financial wellness program is costing you about 2% of payroll every year. That's the cost to the company bottom line. So remember either that 1380, or you can remember 1% in terms of productivity, 2% of an overall cost, okay? So what do we do? What do we do about it? What do employees think they're looking for? What do they need? So we do want to address what the employees want, right? Because in the benefits world, we want to provide them the benefits they're looking for. But we also want to look, is there a gap between what they're asking for and what they really need? So this is a PricewaterhouseCoopers study. It's in the references in the back. But what is the most frequently requested additional benefit? As you can imagine, student loan repayment is pretty popular these days. But the top two are financial wellness benefit. The key here with access to unbiased counselors. So we're going to talk about that a little more on what you should include in a program, not just tools, but in a program. And then at the same level is identity theft and credit protection. And I'm not trying to minimize or take away from that request. It's just that that's not the business we're in. So we're going to spend time talking about this 25% up here. If I ask HR professionals, what's your number one concern? I hear this a lot. Employees don't understand benefits, therefore they don't use them like they should. They're not engaged enough, and we provide them a much better benefit than they're actually taking advantage of. But we're going to focus on the idea that the most frequently requested additional benefit is a financial wellness benefit. 61% want a financial plan. Okay, at Wellspring, we will make financial plans available to your employees who want a full financial plan. Debt elimination or consolidation tools, okay? So there are tools available, but We think the other thing that's important is the ability to meet with a financial advisor. And we use the term here, meet loosely. At Wellspring, we will take one-on-one phone calls. You know, if somebody just has a question about debt reduction or something to that effect, we allow your employees to call us and engage on any financial topic they need help with. So picture what I described to people. Picture that any of your employees throughout your workforce could pick up the phone and talk to somebody who's a CFP at Wellspring, and we'll help them with that. So here's a little bit of a gap in what employees say they want and what they really need. 80% say, well, I need financial planning tools. And I think the key word here is tools, right? Tools are nice, but it doesn't give them everything they need. But only 19% of them are taking advantage of the financial wellness program offer. My point with this slide is if you only give them tools, you give them access to a debt reduction tool or a budgeting tool or something that talks about student debt, then they feel good about it, but most of them want access to somebody to talk to. So only giving them tools is really not going to get them engaged. 63% feel they're confident, but it's the #1 source of stress. This one real quickly kind of illustrates this. I'm going to just give you 2 quick examples of what this graph says. Employees who feel in control of their finances, well, the baby boomers in purple say, well, 66% of us are in control, only 36% are living paycheck to paycheck. That is somewhat consistent, right? If we add up, well, 66%, 2/3 are in control, 1/3 are living paycheck to paycheck, that adds up, okay? But if we look at Gen Z, 60% of them say I'm in control of my finances, yet 56% are having trouble making ends meet. So their perception of their situation may not be true. 54% want an easy button. 32% wanted specific advice. Here's the message. Remember, we go back a couple slides, we said your employees are asking for tools. But add this up, 86% of your employees, 54% want some validation. They want to talk to somebody once they've made a decision, and 32% want to talk to somebody to make that decision. 85 to 86% of your employees would like to speak to somebody as part of their financial wellness program to guide them in their decision. And I say what they really want is hope, right? The 26-year-old young professional has excessive student loan, just wants guidance. The 50-year-old that's married and finally an empty nester wants to know how to take care of his or her parents. And the 40-year-old single parent that just got divorced needs hope for retirement. They look to you in HR for hope, and y'all can give that to them. I previewed this question at the beginning. I want you to take a look at this. If you can get your employees on track financially, and we'll admit that we'll never get 100% on track financially. So the light green bar is those that are on track financially. The blue bar is those that are not on track financially. How many are satisfied with their current job? We see a 32% improvement if they're on track financially. Committed to the organization's goals, see a 24% improvement. Likely to still be working there. This addresses turnover, right? We have almost a 20% improvement, right? It's an 18% improvement. Are they happy? See almost a 30% improvement. Are they engaged? A 25% improvement. Are they productive? We see a 26% improvement. So I think if you get nothing else from this webcast, putting a program in place, not just tools, but a program and getting your employees on track, look at the impact on their engagement, their productivity, and their happiness with being at work with you. So what do you need to have a complete financial program? Okay, and I've said it before, we want to talk about a program, not just tools. Whoever's doing your 401k or your 403b is a record keeper. Most of those organizations are bringing financial tools to bear, and I'm not trying to dismiss those tools as being wrong or evil, but they're not complete, okay? So wellness program is not just a bunch of do-it-yourself videos or tools. It's not a calculator. As I mentioned, these web tools provided by your record keeper, they're credible, they're part of the program, but they're not a complete program, okay? Here are what we think are the elements of a good financial wellness program. As we saw, 85% of your employees want to talk to a live body. So there needs to be some financial engagement sessions, and bullet point number 2, access on all financial matters to one-on-one financial consultations. Remember, 57% of your employees want financial planning, okay? We provide some customized reports to discuss financial readiness for retirement, and you should define what financial wellness looks like. And the last part, we kind of discuss how you're going to measure it. We showed you the one way that you can measure it with a survey, benchmark on the Consumer Financial Protection Bureau, but just come up with a way to do that. Here's some suggested topics for you. This is based on what employees ask for. We always start with basic household financial management. Do you have a budget? If you would ask anybody who has a debt problem, and to me this was 100% when I used to do one-on-one financial counseling as my only livelihood, everyone who had a debt problem, the first question I asked them was, do you have a budget in writing? In 100% of the case, they did not have a budget. I can't promise you that a budget will prevent debt issues, but I can promise you that debt issues, in my experience, come from not having a budget. College planning, 529 plans, managing debt, Social Security, all these are great topics. And if you have a suggested topic for us that you want to do something differently, we can probably put something in place for you. So here are the major points to summarize. And if you've got questions, go ahead, type them in for Rich, and we'll wrap up here in just a minute. But do you have a financial wellness program, or is it merely a collection of internet financial tools? Okay, I just smile a little bit when I say to a company, hey, do you have a financial wellness program in place? And they say, oh yes, our record keeper does that. And once again, no discredit to the record keepers, but they're merely providing you financial tools. Picture where the health wellness program was that Sebastian talked about, and what we do these days with biometric screens and asking them all to take physicals and getting it all taken care of. What if you said to somebody, hey, do you have a health wellness program at your organization? And people say, oh yeah, we give them a Fitbit and a cookbook, and that's our financial wellness program. I think that would all be laughable. So please don't do the same thing with your financial wellness program and call it a complete program. Have you defined financial wellness, and are you measuring it? Okay, and please remember those numbers, that somewhere between, in most cases, it's 20 to 25% being happy, more engaged, likely to be more committed to your organization. If you can get those employees to getting their finances on track, they're significantly more productive, happy, engaged, and loyal. And I'll back up here. The definition of financial wellness, if you've got nothing else to go with, please start with freedom from stress, freedom of choice, in both the short range and long range financial wellness. So last thing, reference documents, they're here all in the presentation. You can download them from the GoToMeeting menu. If you have trouble downloading that, just email me or email us, and we'll get those to you. Questions, and I'll leave my contact information here in case somebody does need to email me a question or a request for those handouts. So Rich, do we have any questions from the participants?
Yeah, we got they're asking if they're not using the survey that you referred to, are there other options out there to get a sense of what the state of the union might be for financial wellness in their employees?
So yeah, that's a great question, and I kind of hinted at it a little earlier. So picture this, okay? In companies I've been in, and I'm speaking as an employee, they might have a campaign throughout the year that was, involving health wellness, that it was who can get in the most steps, right? Or something that the issue was, we're going to measure how many people participate in this program and to what degree they participate. So let's say you're looking at hiring an outside wellness vendor, okay? Let's take what Wellspring does. One of the things we do is we aggregate your employees on the retirement spending report. We show each of your employees where they stand on their road to retirement. We've actually been aggregating that over a number of years, and we can tell you aggregately in the long term, right, is one of the wellness issues, is your employee population getting more healthy or is it not getting more healthy? As far as retirement readiness, now, just like Sebastian pointed out, if you do an acquisition of, you grow your workforce by 20%, and you now take on a brand new set of workers who have never been in the 401k plan and they now have a balance of zero, it could skew the measurement, but it will do that. So if you're looking at some kind of reporting tool for a platform, so one of the popular websites out there is Dave Ramsey and his program, okay, Smart Dollar. You want to look for what the tools are. So I kind of mentioned, how do you measure it? Well, you can simply measure how many employees went through an education module, how many employees put a budget in place, how many employees. So I almost want to give you an answer that I don't want to give a specific on how to measure it, is what does it. And I will tell you from our personal experience with Wellspring clients, it is huge, as y'all might imagine, from your perspective on how you message this to the employees to get them engaged. So I'll answer it in two formats. There are a ton of ways to measure it. If you're looking for something and you can't find it, please contact me, contact Deirdre. If you're looking on the health side, I can get you Sebastian's contact information again. But my answer is just there are plenty of ways to measure. Just make sure you're making some kind of a measurement. So, Rich, anything else? I know we're like 2 minutes to the hour, and we always like to wrap these up on time to get everybody out of here. So how are we doing now?
We're right up against it, so I'm going to just finish up here and thank everybody for attending and remind them that our next webinar is on Wednesday, February 12th at 11 Mountain Time, where we'll talk through the annual fiduciary training, and then on March 11th on what to expect from your record keepers. So again, if you have any troubles downloading the presentations, let Eric know or myself, and we'll be happy to forward those presentations over to you. Otherwise, I'll say thank you very much, and on behalf of Eric and Sebastian, we'll wish you a great day.
Thank you, everybody.